Good morning, friends. I'm Dr. Pranita. Welcome to Pranita's Arogya Advice. So, friends, you're saying that the COVID-19 is creating a threat to India and also to the whole world, right? Now, we are in the second stage or the second wave, I can say, second wave of the COVID-19. But thankfully, now the patients are decreasing, but still, it's not a good number. Still, the patients are in the increasing number, but as compared to the earlier stages, we have now decreased number of patients, right? But according to WHO, now the biggest threat that is coming to the recovered patients of the COVID, that is the mucormycosis, right? The mucormycosis patients are increasing day by day, and also the deaths are also reported due to this disease. So it's like I'm going to tell you some facts about the mucormycosis and some steps I'll be telling you to take care for this mucormycosis so that you didn't get contracted by this disease. Now, this is the disease which is being affecting the patients of COVID-19, right? COVID-19 patients who have been recovered. In these patients, this disease is seen in increasing frequency, right? Almost up to 12 to 15 days after recovering from the COVID-19 infection, this disease is contracting in these patients. The biggest threat to the patients are those who are having the decreased immunity, right? The patients who are immunocompromised. In these patients, the chances of mucormycosis is increasing, right? So it's a black fungus which is affecting these patients. Also, the diabetics who have not, also the patient who are diabetics and the sugar is not under control, they are also having a greater chances of having this disease. Immunocompromised patients, also the patients who have been was on whom the steroids were used earlier for the COVID treatment or for any other treatment for a longer time of course, they are also getting contracted this disease. Now the symptoms which can be seen in the patient contracted with the mucormycosis are the headache, the nasal stuffiness, cold, eye pain, facial pain, migraine, then there is some blurring of vision, and finally if you are not being treated or you're going to the complicated stage, then you will be losing your vision, right? So this is decreasing the immunity and is affecting the whole of the body and also the body's immune system. And furthermore, if it is being complicated, it will affect the neural system, it will produce clots in the blood, and it will be circulating in whole of the body, and it will heralded by the whole black fungus which can spread and can affect various organs and can be very dangerous and fatal and even may cause death, right? So what are the precautions we can take to get prevented from this mucormycosis is first of all, the patients who have been recovered from the COVID-19 infections, or they were in the home isolation or were admitted in the hospitals after their discharge, or your treatment course is completed. So these people, they are advised to be at home. Don't go outside, because again you will go outside, again you will be contracting the COVID patients, and then this infection may again spread, and also this may decrease your immunity, and this will decrease your strength to fight the diseases, right? So after you are being recovered from the COVID-19 infection, just stay at home unless and until it is very much necessary, then only step out of the home. Otherwise, be at home. This is the first and foremost important thing you should do. Second one, I have said that this is affecting the diabetic patients mainly. So what this patient of diabetes should do, that you should check your sugars, blood sugar level regularly. See that your blood sugar level are under control and in the normal range. So and if you found that it is not in normal range, then visit your doctors and just get your sugar checked from them, and also take a proper medicines if it is not under control, because it's a bigger threat that helps in spreading the mucormycosis infection in the blood. The third most thing is that you have to increase your immunity, right? So how you can increase your immunity is you have to just have a green leafy vegetables in your diet regularly. Have a consumption of fruits at least one time in a day, right? At least one fruit in a day. Then they just have a 1 glass or 1 cup of turmeric milk in the night while you are going to sleep. Then increase the intake of fruits or the fruits which are rich in vitamin C in your diet. Have that oranges, lemons, then papayas. Increase consumption of this fruit so that vitamin C will increase in your body, which can fight this infection. Again, have a plenty of water throughout the day. Okay, don't be dehydrated, because it's not good for our body. Not only the mucormycosis but also for the whole of the body functions we need a water, right? So you have a good consumption of water. Then the people who are eating non-veggies, they can have at least a one boiled egg in the morning, and also they can increase the consumption of the meat and chicken in their diet. Okay, these are also help in increasing the immunity. Then ginger tea you can have, and the turmeric milk, this can help you increasing the immunity. The again, the important things so you can do is, after getting up from the bed, have a 20 to 30 minutes of the morning walk. Then after that, have a exercise for at least 30 to 45 minutes. Do surya namaskar. If you are doing meditation, it is really very good. Meditation will help you calm, will help you recover all your immune system, and will give you a peace and pleasure, right? So it's very helpful, and you should go for meditation regularly in the morning, at least for 5 to 10 minutes at least, right? Now you should take care that other fungal infections of the skin should also not contact you, right? So that they should not be in an added infection to this mucormycosis. So for this, you should take care that you should have a proper personal hygiene, right? Use properly washed clothes, wash your clothes properly, take a bath daily, right? After that, take care of your personal hygiene. Use your innerwears which are properly washed. Don't use the very used one, and the inners which were used for very long time, just discard them and take a new one, right? Then the brushes which were used in the COVID, during the COVID course, you just throw off that brush, you take the newer ones and use that. Then the another thing is that you are saying that the climate is very damp now, right? And so just don't go for very tight clothing, just wear very loose clothes, right? Maintain your personal hygiene, live in a clean environment, see that there is cleanliness in and around your house, and there's no unclean environment around you, right? And the foremost important thing is, don't take so much stress, right? Because if you're taking the stress, this will decrease your immunity and also affect your whole body function. So, and this will decrease your capacity of the body to fight against disease. So don't do that. Just be happy and don't take stress. Now it's not like that all people recovered from the COVID-19 infection will have this mucormycosis. It's just some of them will have, because the reasons I have listed above, that they are diabetic, they are immunocompromised, they have cancers, they have skin infections, then they have decreased immunity, right? So these people are at higher chances. And not only these people should take care, but also the patient who are having their blood pressure at a higher values. Then also the patients who are having cancers, then they are having joint pains and other diseases for which they are being on steroids and other treatment. They should also take care and see that the medical values of their diseases, they are under the normal range and they are under control. So the important thing that which can help us to protect us from the mucormycosis infection is just to take care of all of the things to increase immunity. And whether you are having any problem such as headache, eye pain, then redness of eye, facial pain, then or nasal stuffiness, bleeding from nose, then just go as early as possible to your doctors, so that the treatment and the diagnosis and the treatment will go at a faster rate and at early stages. because if you're staying at home due to this all the ailments, and if you're not visiting the doctor, these things can get complicated, and again this can complicate the mucormycosis infection in your body, and it can spread all over the body, and it can create a havoc. So just avoid doing this. Just go to the doctor as early as possible. If you're having any problem, just get detected, get treated, because it's not that all patients with the mucormycosis are going to die or are going to complicate. If you take care of all these things, you are going to defeat this mucormycosis infection as early as possible. Rest, this is about the mucormycosis, and you have to take the regular care of the COVID-19 what we are taking, right? So wash your hands regularly for at least 20 seconds, wear your mask, then just go by the social distancing, right? And as far as possible, don't go outside, stay home and stay safe and take care, right? Just that's for the mucormycosis for today. Thank you.